It's our honor and privilege to have Dr. Anderson here, and so please join us and me in giving him a warm welcome.
I told him he could take any sort of privilege he wanted to with my introduction. I'm from Oklahoma. I'm from a rural area as well. I lived in Chickasha, and I played football for the Chickasha Chicks, and I was afraid he was going to tell you that. That's a pretty humbling type of situation, so it always keeps me on my toes, and I always look forward to playing the Henrietta Hens until they got Troy Aikman and for their quarterback. But I'm honored to be here. When I saw your river, it reminded me how important water was to a river. In Texas, we don't seem to have that component. You know, we have the valleys and things like that, but there's water. There's not much of an opportunity for us to see this sort of thing. What's different about our model you'll see today is the sense of community, the importance of community, not just the going through the turnstile, but the difference between COPC actually and clinics per se. And I have this very tough time to explain this to our county commission, is that we're talking really about improving the lives and the quality of lives in a community and enhancing community, that whole concept, because if we do that for healthcare, they'll work on education, they'll work on crime, they'll work on job creation, they'll work on housing. It's amazing what happens when folks discover that they have it in their power to do this. It's de Tocquevillian as well, so we think it's really something we should do. And it's something that we are still in the process of implementing. We've not arrived. We still have more to do. And as gentrification occurs, which Dr. Duke talked about, the poor are moving to the community. There are inner cities in Dallas, inner city areas I can't afford to live anymore, which used to be places where we had clinics. And I think it's very important for us to understand that this is happening, why it's happening. This year is the first year in the United States where more people lived in poverty in the suburbs than in the inner city. So it's a changing, dynamic situation. What Benjamin Disraeli said about a nation, the health of its people is really the foundation on which their happiness and all their powers as a state depend. I really think that if we lived what we said in our political environment, we would be different today. How many politicians have you heard say the children are our future? Then they behave totally in a different way. We have to be there and be dogmatic sometimes, I suppose, but we need to be also willing to be pragmatic. To try to work with people, try to work with the art of compromise, which is politics, to try to get to where we need to go. And we need, I believe, more important than ever before, a bipartisan approach to these issues, which we oftentimes have in states, but sometimes eludes us in Washington. The other thing I'd like to say at the beginning of this is that the social determinants of health are so important, and many times we're dealing with people and we're dealing with the medical treatment. But I'm a doctor who's been working in a safety net hospital all my life, and I'm proud of that. But I'll tell you, once they get to me, it's late in the process here. It's going to cost a lot of money. When in fact, too, if you look back at life years gained since the beginning of 1900, it's been public health. It's been primary care. It's been access, early access, affordable access that's made huge, huge differences. But here's where the real opportunities are. If somehow we could do something we call managing the in-betweens and work with the other parts of the social infrastructure, education, for example, turns out to be the healthiest thing you can do for yourself in a lifetime. You're more likely to be employed, more likely to have health insurance. If you graduate from college, even more so. So we have to put some emphasis. If we had all the money in health care, would we be a healthy society? No. It's got to be balanced. And so there are trade-offs. We can't have it all. And frankly, healthcare system is only 10% of the pie there, and it's really social environment and physical environment that have a lot to do, particularly with our disparate situation in poverty populations and minority populations. So we want to work on those and deal with those, and we'll get into that in a moment of how we're trying to do that. But 70% of the impact on the determinants of premature death are not in the medical field, but they're in our field. They're in what you do. They're in the community. You can have an enormous impact on those things, and it's very, very important for us to address that. And yet sometimes we actually work against each other. Alfonso Jackson, who's been maligned from Dallas, is a personal friend of mine, actually. He was with the HUD. He helped build a housing project along with Henry Cisneros in a previous administration in West Dallas, which was the highest density, low-rise poverty housing in the country. They took half of it down and rebuilt it. They gave people gardens. They gave them walking trails. They gave them places to be. They decompressed it because they knew from experiments when people crowded too much together, they had more violence. You had more teenage pregnancy. We were having an incubator for ill health in that community. They've now created a community. They had us build a clinic there. They built it and let us run it. They brought in grocery stores, all these kinds of things. You say, what did that have to do with housing? What did it have to do? Why would you put a health clinic in there? Well, the reason is he wanted to create a sense of community and not just be in the housing business. And I think in government we need to think that way, out of the box, because that's a much more thriving community now. It's not creating all the work for me that it used to. We used to have asthma patients coming from those housing projects. 55 to 60% of the children had cockroach antigen. And until we cleaned that up and got the housing authority to do that, we weren't going to get them out of our ER.